Hyperbaric oxygen therapy is not only effective in chronic condition like diabetic foot and non-healing ulcer, but it is also effective in acute settings like air embolism, methemoglobinemia, and carbon monoxide poisoning. Recently, in my practice, we had a patient who underwent mitral valve replacement. Post surgery, she was found to have a very low Glasgow coma scale, which was only 4. When we started investigating her, and when we discussed with the surgeon told during aortic cannulation during CP bypass, cardiopulmonary bypass, patient might have had air embolism. Keeping air embolism as a clinical diagnosis, we did hyperbaric oxygen therapy. Halfway through hyperbaric oxygen therapy, patient started improving, and she was shifted out of ICU within 48 hours. Her GCS from 4, Glasgow coma scale of 4, improved to 15 within, I think, 1.5 hours of hyperbaric oxygen therapy. We had another interesting case in the middle of the night. Both husband and wife, they came to emergency room in an inebriated condition, and they were cyanosed. We got the arterial blood gas done. In oximetry, we found to have very high methemoglobin level. It was 84% and 87%, requiring urgent intubation. And immediately we gave hyperbaric oxygen therapy. Within 3-4 hours, they were extubated, and next morning they were shifted out of the intensive care unit. Recently, we had a very interesting case of an elderly diabetic who came with gangrene. When we found it was a very aggressive gangrene where both venous and arterial Doppler was not showing any arterial or venous blockage. We got the transcutaneous oximetry, and which showed a very low oxygen, perception of oxygen was 3 and 4, which is very low. And we started investigating her as vasculitis, turned out to be vasculitis. There also hyperbaric oxygen therapy was given. Recently, when they came back to the OPD, we found that lady had absolutely gangrene improved. It was basically vasculitis, and of course she required the treatment of vasculitis, but acute condition was managed aggressively by the hyperbaric oxygen therapy.